All right, let's get started. Good morning, everyone. I'm Larry Boris, Executive Director of the National Association for Workplace Healthcare. I want to thank you for joining us this morning. This is one of our monthly webinar programs. Today, we're going to be talking about Beyond the Launch, driving ongoing engagement with employer-sponsored health centers. And we'll be using this opportunity to give you some good information about how do you get people in the door, how do you increase your utilization, how do you make the center more visible to your population. Before I start, I would ask everyone if you would please rename yourself and put your affiliation next to your name. Our format will be that we'll have a presentation, of course. And then at the end for questions, I'll be going around the table calling on people. So we like to know who's sitting in and where you're from. So again, for those who may not be familiar with our group, NAWHC or NOWIC as I call it, we're a nonprofit organization representing employers and unions who have on-site, near-site, mobile, and virtual health centers, as well as their partners, whether it's clinic vendors, hospitals, or health systems, medical groups, etc. Also, consultants, the attorneys, wellness vendors, pharma, others who are interested in helping worksite centers be effective are all members of our organizations. We really try to help organizations get more value from these centers as well as other direct contracting opportunities, whether you're contracting for primary care or other kinds of services at the worksite. There's always an opportunity to improve. So we offer educational programs like this once a month, networking opportunities, as well as benchmarking surveys, purchase import, and a lot of vendor information. So please go to our website, nawhc.org, and learn more about our organization. And if you're not a member, please take advantage of it. But you're always welcome to attend our programs. Uh, After today, these are the next programs we've got on the schedule. There'll be a public employer networking roundtable on March 2nd. We'll have a session on value-driven healthcare solutions in March, and then our annual forum in St. Louis on April 8th and 9th on employer-managed healthcare clinics and direct contracting will be held in St. Louis in person. So we hope you can participate with that. And then there'll be another Worksite Center program. While we help promote it, we don't manage it, but if you're first time interested in that, it's going to be held in Chicago in June. So with that, let me turn it over to Katie Hakimi from Crossover Health to introduce our speakers and start the day. So Katie, back to you.
Yes, thank you, Larry. And good morning, good afternoon, everybody. It's great to be joined by you today. I will just comment, we were just talking about Chicago, as I think three of us on this panel view have lived in Chicago, and June is a great time to be in Chicago. Highly recommend that. I just booked flights to visit family the beginning of July. So for those of you that don't know me, my name is Katie Hakimi. I am the channel team lead at Crossover Health. What that means is I work closely with our broker and consultant partners as well as business group partners at Crossover Health, and I've been with the organization for the last 4 years. I am joined by Cassondra Hepburn with Jackson Healthcare, one of our client partners, and Dr. Hari, who is one of the physicians that works closely with Jackson Healthcare. And for those of you that are less familiar with Crossover Health style, today we will be doing more of a panel discussion. So I'm going to have Larry leave this beautiful slide of our faces up for the next several minutes here as we have a discussion on engagement. And so to kind of get things started, I just want to share that Crossover Health is an advanced primary care organization who's been delivering primary care and what we call advanced primary care in the market since 2010. So now over 15 years into our 16th year. We're grounded in a biopsychosocial model that really focuses on the members at the center. And so we are always very excited to talk about engagement because from the beginning, we have been putting that member at the center and focusing on what gets them to engage in their health. We provide them with surround sound support from their primary care physician, and we'll have the perspective of Hari today and how he works with members and the groups that he works with. as well as mental health providers, physical therapists. We have care navigators, and we do this all in person and virtually so that individuals can access care in a way that's most convenient to them. Crossover has grown in the last 15 years to have over 1 million members that we're providing care to. And one thing that I think is unique to Crossover Health and just, delivery of advanced primary care in general when it's set up through the employer-sponsored program is that 81% of our members choose Crossover Health as their medical home. So that is the place that they go to for their primary care. Now, we don't require people to, see Crossover Health and the physicians in the clinic as their PCP, but it is certainly something that drives the overall experience and engagement. And Cassandra and Hari will talk a little bit about that in a moment. We are in physical health centers on site. So Cassandra will talk about the Jackson Healthcare Physical Health Center. We have a network of shared employer near sites across the country, and we are virtual in all 50 states. So when employers like Jackson Healthcare, who you'll hear from in a moment, invest in delivering access to primary care, it is crucial for us to deliver on that and get people engaged. They are investing in the health of their population and wanting to make access to care easy, affordable, simple for their population for a variety of reasons. And so it is in our best interest to ensure that we are doing everything that we can to make them feel at home, like they want to engage with the care that we're providing. So if we're not doing our job providing engagement, then that's going to hurt us in the long run. So what's also wonderful about when we talk about engagement, it's not just Hari, the physician, it's not just Cassandra, the benefits leader, it's a whole team of people. We'll talk about the different care team members and the importance that they bring to the model and in helping deliver engagement. And it's also different perspectives. So that's what we hope for you to hear today throughout this discussion. And of course, we will end with some key insights, key takeaways that you can write down, and we'll send out these notes afterwards. And then we'll also open it up to questions. So that's a little bit about me, about Crossover Health. And without further ado, I would love to have Cassandra have you introduce yourself and share a little bit more about Jackson Healthcare.
Sure. Thanks, Katie. It's great to be here today. I'm Cassondra Hepburn, VP of Benefits and Wellbeing at Jackson Healthcare. And Jackson Healthcare is a family of highly specialized search, staffing, and technology companies related to healthcare. Our mission is to improve the delivery of patient care and the lives of everyone we touch. And that, of course, starts with our own associates. So we are very passionate about having benefits plans and well-being services that help our associates and their families. I've been with the company for about 9 years, and I manage all the health and welfare and retirement benefits as well as the well-being. That's been a personal passion of mine. I've always been committed to corporate well-being because let's face it, a corporate setting is a great captive audience, so to speak. It's also a place where people spend a lot of time and they trust their employer to help support their health journeys. And that's why it's really important for me I chose this organization because of their commitment to well-being, because we were not only a great places to work, but a healthiest places to work. And that was important for me to try to be part of that and to raise the bar as much as I can. We have been committed to overarching health clinic kinds of services for a long time, ever since I got here. But it has definitely evolved through the years, and it's evolved even more with our partnership with Crossover Health. But we can talk a little bit about that as we go. But that's just a little bit about me and our organization.
Thanks, Cassandra. And Hari, I'd love for you to introduce yourself as well.
Thanks, Katie. My name's Hari Threya. Really excited to be a part of the webinar today. My background, I am a family physician who also has a master's in public health and a fellowship in preventive medicine. I am the lead physician at Jackson Healthcare. I've been here about 2 years now. It's been a great opportunity to really be able to practice being a doctor, but also having an opportunity to practice the community health and health promotion skills that I learned during my public health training to move the health of the employees, associates of Jackson Healthcare forward. And one, have the clinic there as an accessible resource for them, but also to think a little bit upstream about how we continue to keep patients engaged and healthy.
Awesome. Thanks, Hari. Um, so one of the reasons I love having the two of you represented in this discussion is because when I think about like what strong partnership looks like, it is Jackson Healthcare and Crossover Health. There's so many great examples of, even in just the last 2.5 years, how there's been a lot of commitment and building on what Cassondra had been in place, I think for many years. And so I think that's a key point, is like there's a lot of iteration and building upon wins and successes, but keeping momentum to continue to excite and ignite people and engaging in their health. Um, Cassondra, I'd love for you to talk a little bit about like the start of the health center at Jackson Healthcare and like what initial success metrics you thought of, and maybe how those have evolved over the years that you've had something in place.
Yeah, sure. So this has been in place. I think we had clinics for about maybe 13 or 14 years. It was started as we kind of affectionately called it the broom closet clinic because it was really literally in a very small space with one exam room and an office slash waiting slash everything else space.
You got to start somewhere.
Was that?
You got to start somewhere.
Exactly. But what was great is we were able to claim some space in our building and build out what I think is a very beautiful facility with multiple exam rooms and lab and storage and all the stuff that we never had before. And that's been really great, just to have a great physical space. I think it started more as a basic primary care and well-being. That was a wellness focus when it first started, but it was limited to the folks that were on this campus. We're located in Alpharetta, Georgia. I think at the time when it was started, there were maybe 400 or 500 people in the company, and they were mostly here. Now we have over 2,000, and we're in all 50 states, whether it's a hybrid workforce or some other of our satellite locations. And so what needed to happen was we needed to go beyond the walls of our clinic and be able to offer care to all of our associates. And that was really important to me. So when I started, I noted that is, a pretty big discrepancy as to what kind of care was available to folks who were here within proximity and who weren't, which is one of the reasons why we chose to move to Crossover, because they offered that national virtual wraparound, as well as the on-site option. The other things that have really evolved, and I think that I think the start was always supporting our associates, making it easy, making it convenient, making it quality care, having a little bit more time with their provider. That was always important from the get-go, and that still is. But we've also evolved into really need to address the whole person, and it's hard to do that without having other virtual services. So we've been able to add care navigation, which was a very big, I think, improvement, because a lot of people don't know where to start. You ask you have an injury, ask your neighbor, who do I go to? Well, the great thing about our provider relationship is there's a care navigator who takes that on and really helps to get people to a specialist if they need to. We also have the virtual mental health, which is a very important and highly utilized benefit through the relationship, and that's evolved, with COVID, and also, just the importance of mental health becoming more and more prominent and acceptable to talk about in the workplace and to support. That was a key add for us. We also had coaching before, but this is a better approach and more robust coaching and experts that are available to associates, and this is all free of charge. So that really takes those barriers away. We would have people, be able to come in and get care, but they weren't able to get all the care they needed without, having to come out of pocket. If it was a mental health thing or something like that, or coaching, this is all free, and that's been super helpful. The other thing that we were able to do is partner with a local pharmacy for, the RX part of the equation, which Hari can talk about a little bit, but was great because it allows the providers to, have that resource, but not have to be the ones actually dispensing or anything else. So that was another thing. I think additionally, and we've always had a wellness incentive program, and that is another thing that has evolved through the years, but that was often the entry for folks to get engaged with our clinic provider. And it still is. We have a fairly young population. We have a lot of people who this might be their first job out of college. They don't necessarily have a PCP. They might have pieced together, urgent care here and there and, whatever. So this has been a great way to get them with a great, primary care provider with continuity of care, as well as that, like I said, that care navigation. And sometimes it just started with, hey, they were involved in the wellness program, and all of a sudden, oh, I do need primary care, and here's how I know how to get it. So I think that's, really how we've evolved, and we're continuing to move the bar. But I'm excited about, the course that we've been able to see, and just, the growth and I think the engagement that has resulted from these different services.
Yeah, that's amazing. So it's in the kind of benefits realm, right? There's a lot of point solutions, and like there can be fatigue or confusion, like, okay, where do I go to for mental health? My company offers
Right.
these things, and care navigation. Do I use this benefits advocacy tool, or do I use
Right.
one thing that I think is valuable that you alluded to within the care model is that you could just walk into the health center, or you could pull up the app and
Mhm.
let Crossover help you figure it out or where you need to go. Um, Hari, I'd love to hear from you, like the physician's perspective, how like having these different avenues helps you as a provider engage with your members, and you're not just working in a silo, like you have these other resources that you can work as a team to support Cassondra's population.
Yeah. Um, it's been really fun, honestly, to be able to work within the parameters that and her team has laid out for us. I'd say our approach to trying to build relationships with new patients is that everyone that walks in that door, we try to make aware of all the services that are available to them and how that can impact their care. And I
Mhm.
think what really helps us is Cassandra's team has laid the groundwork for us, in that the clinic space itself is really warm. It feels elevated. It feels calm. We're able to complement that with our staff that can make people feel heard, paid attention to while they're waiting to get into a patient room. The wait time is usually less than 2 or 3 minutes before you can get back, and a provider can get to you. But I think the small things, just like making patients aware that we can get medications delivered to the clinic where they can come downstairs from their office or come from their home and pick up meds seamlessly,
Mhm.
at a discounted rate, that we don't have big copays for them to come visit us. So every time that they need to interact with us isn't another out-of-pocket bill for them. Or if they're running late, like we're really accommodating. We don't turn away patients for just a late fee or because patients are running late, which is really uncommon out in the community. I think during the visit itself, I think the model of allowing for at least an hour for physicals or half hours for all other appointments really lets your provider sit down and talk to you. I think, especially during physicals, there might be like 10 or 15 minutes before we even talk about anything that's really medically critical about a patient's care. It's about getting to know the patient. It's about building a relationship, getting to know who they are as a person. And I think the visit usually concludes or it drives towards making sure that they also know about our care coordination services, our virtual mental health, our virtual physical therapy, our virtual talk therapy services that are all free for the associate, and then having a discussion of where they want to get ongoing care. I think a lot of times, like Cassandra was saying, it's a younger population who hasn't had the time to develop a strong relationship with a provider out in the community. And so when they hear about everything that we're able to offer and have the accessibility to get in within usually like 2 or 3 days max, people are ready to sign up or transfer their care if they don't have a strong relationship. The patients who don't decide to use us as their primary care doctor, it's usually because they've been seeing their community person for a long time, whether that be like over 10 years, 15 years. And for us to compete with a strong, meaningful relationship, um, is challenging, but I also think if that's the most therapeutic for that person and they have a well-established history with the provider for that long, like I want to support them in that way. And then I think we are able to help those patients if they have issues accessing their physician's office for an acute issue. And so it's
Mhm.
helpful to get to know them and just reminding them that in those, whenever they do need us, we have an understanding or we have at least started to build a relationship and they're welcome to come use us as well.
Yeah, I think it's great. Having personally received care from Crossover Health over the last several years, like that relationship component with your provider, or providers, and care team is key. Hari, I know you mentioned in a prior conversation an individual that works in the clinic, I think it's the host, has become kind of famous, as I'm sure you are on campus at Jackson Healthcare, but would love for you both to comment just a little bit about how you expand, access to care and drive engagement through different activities and events on campus and both off campus virtually for folks beyond just the walls of the health center.
Um, yeah, absolutely. I think the host that you were talking about, I think we believe in our team is in trying to highlight everyone's strengths. We recognize that everyone at Jackson Healthcare might resonate with someone different on our team. So we want to make sure that they feel comfortable with everybody. And I think that makes everyone on our team feel more empowered and lets us help people more effectively. And I think in terms of engagement events on site, it's been really great to yesterday I was actually at the gym on site talking to people about things that we could do to improve their heart health, coming up in a upcoming webinar that didn't include medication. So a lot of like lifestyle changes that people could make. I do events like that um, at least once or twice a month. And I think in terms of reaching the virtual population, it's been really fun to partner with Cassandra on some of our health topic series that we've called What's Up, Doc, where we address issues like mental health awareness, as well as like holiday stress, the flu, things like that. But I'll
Mhm.
let Cassandra jump in as well.
Sure. That's what's special is, we have this great, fantastic group of providers and team there. who really do, fit our culture and, serve our associates. But I think what's nice is the approach to get outside of the clinic walls, so to speak, like Hari was saying, that having what we call tabling events where they might come to one of our restaurant cafes and just be there, promoting something, asking questions. We've sometimes done some fun things like having mocktails alternative around the holidays. Not a big surprise that we have a young population, and they're not afraid to drink. So we were like, well, here's how to continue to enjoy alcohol, but maybe also enjoy some mocktails and do some other kinds of things. So we have used some of the data from surveys and just some of the reasons why people are seeking care, to look at how can we address this in a way that's not imposing and non-judgmental, and also just kind of fun. We have different other kinds of events and other partnerships, which I appreciate. I host a quarterly wellness summit with our internal partners and our vendor partners. And so we have our medical plan partners, Crossover Health is represented. We have our internal marketing and facilities teams and our fitness center folks, and we use our the vendor that does our food services here. We all work together. That was one of my goals, as if we look at whole person health, all these areas affect us and impact us, and how can we work together so our associates view us as kind of really trying to have synergies, and this is a coordinated approach, and also know what each other's doing so that we can complement and help each other, not compete necessarily. So we try to do things. I know, like Hari and team will have on-site mammography, for instance, and they'll be there helping to get that information back to the clinic, and they have been able to follow up and give people, the results a lot quicker than we would have if we were waiting for the provider to send it to us. And that was just a really nice add. It's never fun to be waiting on your mammogram results, and to have that information in a day or two versus a week was fantastic. So those are some of the, I think, small and big ways that we've been able to say, we care about you as a whole person now. And Dr. Hari's, he's popular now. He's our What's Up Doc host. So he has to get an agent pretty soon, probably, because his face is out there. But we do try to have some fun with it, and also try to get associate feedback for what are the services that you want, what's important to you, and how can we address them, if at all possible.
Awesome. You mentioned some data in the mocktail example. I know one thing at Crossover Health that we do when individuals participate or engage with Crossover, they complete a social determinants of health screening.
Right. Mm-hmm.
Something that the account management teams, as well as the provider teams like Hari, take a look at that data, and they provide that back to you, so that you can make informed decisions about how to engage the population. I do have a kind of like a two-parter question, I guess, in follow-up to that. One, let's just start with the first one. So that being, you mentioned the quarterly wellness summits. We talked a little bit about data, how you ensure that, this clinic and the virtual clinic aren't sitting in a silo, but really like how you and your team work with both the medical group and the broader account management team to make sure that you're continuously making improvements and moving things forward.
Yeah. I mean, I think that's really important. I think there's a little bit of a balancing act, because in an employment setting, you definitely want associates to know, hey, this is all HIPAA protected. This information's private. They're not telling the HR team who did what. We're getting a report of who was engaged, who gets wellness incentive kind of thing. We don't have that PHI data. Because there are still people that are skeptical about doing something on the work site, because they're afraid of that information, being used against them, so to speak. So that's always something that I let all of our new hires know. That's in our materials. That's very important. That said, we get aggregate data and we get feedback, And we're not a shy population. Dr. Hari can tell us, I'm sure, we're pretty open about things. But, we look at what are some of what are some of the concerns? What are some of the social determinants of health show? And then we try to use survey information too. We participate in national surveys like Great Places to Work and stuff like that, but we also have internal associate satisfaction surveys, and those are taken seriously. And we can't do everything that associates want. I think doggy daycare is really, really high up there on the list, and I might vote for that too. But we're not there yet. But we try to show them, hey, we've listened, and we're here to try to improve and make all of your benefits have the most value possible. So that's one thing we do. And I think we also really focus on educating, because Hari and I kind of share this passion. I'm a health educator at heart. So I feel like if associates aren't aware of their benefits, or they aren't aware of their offerings or how they work, they just aren't going to get the most value from them. So it's a constant effort, because people hear things when they need to hear it sometimes, or they need to hear it a few times before it clicks in, or all of a sudden they have an acute need for something and they have to hurry up and figure it out. We've got new associates coming, so it's always a challenge. I think a constant focus is, how do we continue to promote? How do we continue to educate and support? And then how do we keep it fresh too, so that we're not just saying and doing the same things we do over and over again. So we look at ways to freshen up the wellness incentive program with different activities, different engagement, and we also just try to do as much of the feedback that we can incorporate, and then let people know that we have heard you and we are doing something.
Sure. Great. So we've talked a lot about employee engagement and different ways to drive, both new hire and, younger populations. Can you talk a little bit about the overall programming as it relates to spouses and dependents, and, what they have access to, what they may not have access to, and how you think about engagement for those groups?
Sure. We do offer all of our clinic primary services to associates, spouses, and dependents. That the proximity, we obviously have more. I think we have about 85% of our eligible associates who have an account with Crossover Health. And I think about 20% of the associates do, their dependents do. So we don't, I think proximity is one thing. Our wellness incentive program is designed for associates. Spouses can participate. There's no financial incentive for them to do so, but they can have a physical, they can be engaged, and that kind of thing. It's not designed for them per se, but the educational resources and other things related to all of our clinic services and virtual is available to their dependents and spouses.
And Hari, one thing I want to kind of click back into based on the discussion that we've been having, we've talked about, on-site engagement, getting people in the front door, meeting them where they're at in the physical community. And we know there's a virtual component, but for you specifically, I'd love for you to touch on how you keep, the panel that you have, your members engaged, and interacting with you as their provider, leveraging different technology and tools that, if you have a young population, which Jackson Healthcare does, they might be coming to get an annual physical, but what are the maybe different digital touch points and ways that members can engage in between those visits?
Yeah. I want to come back to how advantageous asynchronous messaging has been, but I would say what I've really enjoyed about being an on-site clinician is being able to first just start to listen to people on campus, and then you get to start to meet more people who are more socially connected or who play bigger roles on campus, and then see how that translates to your patient population. And I'll say I've gotten close to some of the people in the cafeteria as well as the local gym. And so I'm telling employees to go visit so and so, and it goes, and the opposite is true too. And I think being able to build friendships with other people part of the benefit package for Jackson Healthcare, I think only makes things better for the patients that we see because to Cassandra's point, um, everything is connected, and I think we really try to take a whole health approach. I think when we're talking about how we can leverage technology, I think for the last couple of years, what's been a real advantage is our patient portal messaging system, as well as our app. I think about how everyone is getting busier right now. For work, you're having meetings or you have to go to this or that in your personal life, and it's hard to make time to go see your doctor. And I think you compound that with doctor's visits being scheduled months out. Um, and if you try to call your doctor's office, you have to go through like call system, or it takes a couple of days to get a call back to be able to get the thing that you're needing if it's a medication refill or whatnot. With our portal messaging system, patients have direct access to their providers. So a lot of times they're able to get whether it be help with a simple medical problem, say someone's having an issue with a simple UTI, or they need a medication refill, or they need help with a referral, we can take care of that in 10 or 15 minutes. And that instead of someone having to take weeks or months sometimes, like trying to get something resolved with their uh, PCP in the community, we can take care of that within the same week and get them scheduled for an appointment within that same week as well. So I think being able to give people access to us and take away some of the barriers in that way to speaking with your provider, I think helps us build trust and engagement. And if you wonder if that's a burden on our team, our model has a dedicated hour per day for us to be able to respond to messages like that. And oftentimes within our given workflows between how our appointments are scheduled for a half hour or an hour, we can find time to check those systems. And if we don't, our nurse manager can help us address issues with patients as well. So usually we're able to respond to any um, asynchronous message that we get from patients the same day, which I think really helps. I think moving forward, we just launched a new program called Wellright that really focuses on how we can customize health incentives as well as educational experiences to each individual associate or employee that's coming through our clinic. So by not just giving out generic information about what to do to stay healthy and really tailoring that to people, I think we can offer better recommendations and further drive engagement.
Yeah, that's healthcare experience. And I know, Sandra, you hit on a little bit about Jackson Healthcare's overall population. I think it
Mm,
um, tends to be a little bit younger.
right.
I'd love to hear how, I guess, both Cassandra and Hari, you think about that outreach to the different types of population. Maybe we'll start with Cassandra. I know one of the things that Crossover Health does within every clinic that we have across the country is like there are daily huddles. The care team looks at, okay, who's coming in
Mhm.
day, what does their case look like? How can we best support them and help them? There are nurses in some cases that are reaching out and doing proactive outreach related to chronic condition management. We have our care navigation services, but you're also getting, claims data and you're looking at your overall medical costs. How do you think from an overall perspective, like what is Jackson Healthcare strategy for tackling some of those high cost individuals and hopefully getting them to engage in the health center, and if you've done anything specifically related to chronic condition management or high cost utilizers of the system.
Yeah, definitely. So we do in partnership with our healthcare consultants look at our claims data and also the data in the clinic and kind of run through how those align and what are some of the top conditions. I know Hari and team has been focusing on some chronic condition management with diabetes and has had a lot of success, and I'll let Hari talk about that too. Um, you know, in every health plan and every employer who's got a self-insured health plan particularly are focused on costs and making sure that there aren't we can get the claims and the health of the population as healthy as possible. I'm always about prevention, and this is part of the when you have a solid foundation of primary care health, typically that's going to help catch something earlier and hopefully either prevent something worse from happening or just catching it earlier. Obviously spouses I think traditionally are high. If you look at just across the country, for whatever reason, if it's adverse selection or however it works out, spouses are often a higher cost. We can help that by having our spouses and dependents be eligible to participate, but it's not always happening because of convenience and stuff like that. But that's important for us to always be available. And the other thing that we try to do is just understand that these benefits through Crossover Health are available to all of our associates. They don't have to be on our health plan. And there's definitely different feelings about that because some employers would have that as part of that. And ours philosophy is we want our whole population to be healthy. And you never know when somebody is going to be on your health plan. So let's just help everybody, and focus on the well-being, the wellness part of that, making that a priority. I think the other things that we've been able to do is look at problem points. Like every, organization, we've got situations where I don't want to pick on what, the traditional VIP, but, somebody who's got a super busy schedule and never did, get the app downloaded and all of a sudden has got a crisis. And that becomes, urgent for everybody. And, the provider team's trying to squeeze people in and, keep everybody happy. But so we decided to try to do a different approach, and we call it our proactive program. So we looked at folks that either had, in terms of their scope of responsibilities that were tighter schedules, or maybe have some unique health issues that the crossover team knows about and needs more monitoring. We're trying to have a program that there was an outreach to them, say, hey, did you know you have this? Here you can start with an annual physical and we can get things set up for you, and every quarter you can touch base, and hey, did you know you can text us, and you can you can be involved in that way, which is huge for our population. So a lot of it was just saying, hey, we recognize you're busy, we recognize your schedule's tight, and let's help you get a relationship with us now so that when you need that urgent thing, you're set up, you're good to go, we know you, and or we've already had that refill ready for you. So that was one of the things that we tried to do, in part, to help everybody. But I think that's been a success, and Hari can probably talk a little bit more about that and chronic condition management as well.
Yeah, a couple things. I think that it's been interesting being over the last couple of years. I think I can definitely see a change in engagement over time. So it's been really lovely to see the efforts that we're making starting to take even more and more, or bear more and more fruit.
Mm-hmm.
Our system, we have Crossover loves to measure. And so we have lots of ways to measure how well people with chronic conditions are doing. And we have the way to monitor who those people are and do direct outreach. And we do that specifically with diabetes. Our care access model allows us to, instead of have to depend on 3-month follow-ups if we're titrating someone's medications, or we just need to do ongoing health education with people, with us or our health coaches, we can see them on a weekly or biweekly cadence, like without really stressing the system. Um, I think that Cassandra brings up a really good point around what brings me a lot of joy is those difficult to reach patients, namely spouses. Like I think we've all have friends or like family who know someone who hates going to the doctor, mistrusts them, hasn't been in years. Um, and what brings me the what makes me feel like we're winning or doing something right is when someone wants to bring their family member um, to us instead of whoever they were seeing. I think when that family member is someone who hates going to the doctor and their spouse or parent sees us as something different, like they can cross over and see the other side of how healthcare can be. I take a lot of pride in that. And I know that I can think of a couple of cases where we've had patients who historically have been stubborn and end up in the ER or in the hospital. And we've been able to avoid some catastrophic cardiovascular attack, like issues for those people by their spouse trusting us enough to convince them to bring them in to see us. And I think those are huge wins for me. I think we see similar traits when I know that we're building good trust is when employees who have been here for a couple of years heard from their coworkers that they should come try us and that
Mhm.
it's different. Like that's where I know the grassroots messaging is going on. And I think that's a real measure of success. It's not incredibly quantitative, but I think that subjective message is really important for us to kind of take root.
Mhm.
Um, and I think the data side of me, the public health side of me, like we track what people are coming in for. We look for patterns in what issues are going on. We're in constant communication with Cassandra and coming up with ideas of what we think could be effective or proactive about helping the population meet their needs. And I think that part's a lot of fun as well.
Mhm.
Yeah, that's awesome. And I think it just goes to show that it's very well-rounded, multi-pronged approach to delivering great care, but ongoing engagement. And I know, Larry, we want to open it up to the group and if anybody has questions, but I will just say as everybody's maybe gathering their thoughts or thinking of questions, I wanted to highlight some of the key takeaways from the discussion that we've had so far. So I think first, engagement must be intentional and ongoing. Cassandra mentioned that they've had, they started with a broom closet 13 years ago, and they've got this, beautiful health center today. Now, they now offer virtual services, but this isn't the end. This is like, it's constantly iterating. And it's nurtured. It's well beyond year one excitement, and it requires everybody coming together, that strategy, collaboration, and evolution. Making the health center the front door to care. We talked about the physical front door, but also the app and making that the front door for both in-person and virtual members. So positioning that health center as the primary medical home and the place that you can go to, and then that care team will help you figure it out. And there are things that help get people there, like incentives and integrated wellness programming. Hari was just talking about trust, and some of the great examples of when employee or associate trusts the care team, that they bring their spouse there, they bring other colleagues there. And I think that can be incredibly valuable, and making sure you have that trusted relationship. And then finally, an integrated partnership is key. Cassandra, you talked about the different quarterly summits that you do beyond just, your worksite health center vendor and that team, but also the additional groups that are involved for that ongoing collaboration. And so that engagement requires true cross-functional collaboration. It happens in the, small setting of the on-site health center with Hari and his care team. It happens with Hari, the crossover team, and Cassandra's team, and then the broader extension of the different partners. So If you are to take away anything from this discussion, let these be the things. You can screenshot them if you'd like. And then, in the last 10 minutes that we have here, would love to open it up if anybody does have questions. And Larry, I think you have a way of going about it too.
Great. Thank you all very much. Yeah, what I'm going to do is go around the table. I will call your name, so please unmute yourself if you're muted, and give me any comments or questions. So let's start with Amber Rule. Amber, any comments or questions?
I just wanted to share. I think it's really great. I took a lot of notes. Sounds like you're doing really great work there. And I really liked the SDOH screening and using that data. I think that was really helpful.
Yeah,
Thanks.
by the way, we will have a recording link and note and summary of this session that we'll send out to everybody, so you don't have to worry about additional note taking. Brittany White, Brittany, any comments or questions?
No, but thank you so much for the information. It's very helpful, for sure. Thank you. I appreciate it.
Thank you. I have a C. Baker. Um, any comments or questions? C. Baker?
No, not at this time. Thank you.
Okay. I just have somebody's initials, CK. Any comments or questions? If not, Corey Bird, any comments or questions, Corey? Okay. Dawn Carey, Dawn, any comments or questions?
Oh,
No?
let me see, unmute. I
You're,
really
you're good
like
now.
the, oh, good. I really like the key takeaways. I did screenshot it, so that I had some fuel for our program at Purdue. Thank you for sharing.
Thank you. Deanna Hahn, Deanna, any comments or questions?
No, thank you very much.
Great. Ed McNamara, Ed, any comments or questions? Okay. Heather Myers, any comments or questions, Heather?
None for me. Great presentation.
Thank you. Kristen McKellen, Kristen, any comments or questions? Okay. Manhia, any comments or questions? Okay. Megan Talk, any comments or questions?
I just thought the mocktail idea was a really fun way, a different strategy to help engage folks. So I really enjoyed that and great presentation overall.
Great. Thank you. Robert Baird, Robert, any comments or questions?
No, thanks. No comments or questions. Great presentation.
Thank you. Xavier, any comments or questions?
No comments or questions. Thank you for the information.
Okay. Uh, I did want to ask one of my own, if I could. Cassandra and Katie, in general, how do you define engagement? And Katie, what would you say the book of business average is for engagement? And Cassandra, what's the level of engagement with all your efforts at Jackson Healthcare?
So I'll just comment quickly. I mean, we have like literal definitions of engagement for PG purposes where people
Hmm.
actually seek care at the health center. So we have active registrations, but then we go beyond that and it's actually seeking care with a care team provider. But it really varies, and as I'm sure some of you can imagine, given COVID and the different modalities that we offer. We see upwards of 70 to 85% engagement when you do have an on-site health center. When you have a near site and virtual, that is going to be, lower, like 15 to 30%, depending on uh, like where people are. I will say the partnership, so this last bucket here, the integrated partnership is key to making sure we get those numbers and that we can have a collaborative approach to driving engagement, and getting in front of the population to make sure that we can achieve those goals.
Great.
Yeah, just to piggyback off of that, I think our engagement is in kind of two-pronged. One is with the clinic population, I think we have 85% of our associates that have accounts and have had some interaction. Obviously, if you don't need to use, those services, you don't need to. But the wellness incentive program is designed for everybody, and it's designed to be a personalized journey. So we have about 45% of our eligible associates participating in the program. And of that population, 50% they were engaged all 4 quarters. So the way we have it set up is a quarterly activity and in addition to an annual biometric screening or physical. So doing basically 5 things a year to have an financial incentive. So that to me is pretty important because any kind of wellness or any kind of health is never one and done. So the more regular engagement we can have and capture will be great, because that's when they do need the acute care, or they do need the mental health support or physical therapy, then they know where to get it. So I kind of look at that a little bit as a baseline for us. And also the net promoter score is important. We have a really high, I think it's like 95% would say that they would recommend it. And Hari just shared about how, somebody got their spouse in. That's huge. I mean, that's a simple number, but it's really important that it's that high for us.
Great. Also, a question again for Cassandra and Katie. What incentives, if any, do you offer? And Katie, again, across your book, what do you see, or what do you recommend to people?
Yeah, so I will say, Wellright was mentioned. They're a new partner of ours, and they're essentially our incentive management platform that we partner with from a well perspective. So Cassandra can mention a little bit about how that is structured for them. We honestly see a wide variety, but I would say from a book of business perspective, mostly people are incenting. If they are offering an incentive, it's to get people to have an annual physical. So really about driving that initial visit or engagement is a key component. And coming from a consulting side prior to being at Crossover, I think folks aren't trying to overdo it in terms of the number of activities, but really meaningful activities that are driving that overall engagement in their health.
Yeah, to piggyback off of that, we offer a financial incentive. It's not tied to outcomes. It's tied to being engaged. It's $100 a quarter and an extra $400 bonus if you're engaged in all 4 quarters and do that biometric screening. So we've kind of used that as I know some people use it as maybe a premium reduction and that kind of thing. This is not. This is cash basically on your paycheck. But it's, designed to be something that just getting people to be engaged with a little extra, incentive to do so, and hoping they'll continue to, something different and move the needle on their health and well-being.
Great. Well, we're at the end of our hour, so I want to thank very much Cassandra and Hari and Katie for their wonderful sharing knowledge and experience. I want to thank you all for participating. Again, we will be sending out a recording and summary to everyone on the call. We will be posting it on our website and our newsletter for our members. So hope to see you at a future NOWIC program, webinar, or again, April 8th and 9th in St. Louis to meet you in person. Thank you all very much. Have a good week. Take care, everyone. Bye-bye.